Good morning. My name is Joe Moeller, and I'd like to thank everybody for coming. Today's online event is brought to you by Parkinson's Community Los Angeles, and we are focusing on the impact of COVID-19 on daily life with Parkinson's. I serve on the board of directors. We are a LA-based nonprofit, and our goal is to connect individuals and families to the information and support they need to live their best lives with Parkinson's. Today's event is part of our Let's Talk Parkinson's series. These events are brought to you by our sponsors, Abbott, AbbVie, Boston Scientific, Medtronic, Linda and Stuart Resnick, and US World Meds, all of which we are very grateful for. Today we're going to hear from Dr. Eric Johnson. Dr. Johnson is a clinical psychologist from UCLA, and he's going to talk today about how to handle stress and anxiety and how to avoid feeling isolated while staying home. Before we get started, I'd like to give you a few rules to make sure everybody has a great experience. One, please make sure you are all on mute so that everybody has a chance to hear the doctor speak. Please note we will have time for questions at the end. You can submit them to the Parkinson's team via chat, and we will go through them chronologically to make sure we answer as many as possible, as quickly as possible. Since typing may be difficult for some of you, I'll ask for verbal questions from the audience after we've gone through the typed questions. I'd like to just politely ask everybody to please keep their questions on topic. If you have questions outside of what we're covering today, feel free to contact Sarah, myself, or the PCLA team, and we'll get you an answer as quickly as possible. Now I'd like to introduce our featured speaker, Dr. Johnson. Dr. Johnson received his doctorate in clinical health psychology from California School of Professional Psychology. While completing an internship at the Behavioral Medicine Clinic at UCLA, he joined the Department of Neurology doing research on Huntington's disease. Dr. Johnson became a staff psychologist for the Huntington's Clinic and began seeing patients with Parkinson's disease in private practice during that time in 2011. He joined the Movement Disorder Program at UCLA as the Fenton Coordinator of Atypical Parkinson's Disease Clinic. Dr. Johnson provides clinical services to patients and families living with Parkinson's disease, Huntington's disease, and atypical Parkinson's disorder. Dr. Johnson, thank you for joining us today.
Joe, thank you so much. First, for having to get through all that stuff in the intro, which it seems like we never make those easy. So I appreciate that. But thank you guys for having me. And thank you for everyone who's tuned into this. It's a pleasure to be here. I think these opportunities to talk to bigger groups of people about things that you're dealing with is just a great way to, one, connect, but then to just really share information as a community that will hopefully be useful for you all. So as Joe said, I'm going to be talking about, the official title is The Impact of COVID-19 on Daily Life with Parkinson's Disease, but we're really going to focus on the impact of stress and some of the mood symptoms that can come with that, anxiety, depression, etc. So I'm going to make sure I get my presentation up here and we'll flick through that. And then when we get to the question point, we'll just go back to looking at each other's faces. So hang tight. I'm going to get my screen up real fast. All right. Okay, are you guys all seeing a screen that says the impact of COVID-19 on daily life with Parkinson's disease? And hopefully just not pictures of my dog.
We are.
Cool.
Full screen.
Awesome. Well, let's get going. Impact of COVID-19 on daily life with Parkinson's disease. We could very easily take out with Parkinson's disease on this, and I would hope it would be an applicable conversation for everyone, but we are going to talk about it with a specific focus on PD. I don't know about you all, but I can tell you what life is like for me during this time of COVID-19. It really is a different experience than I think any of us have had the opportunity to deal with or live through. So it is not uncommon. And in fact, I'll change that. It's very common during this time for people to report an increased sense of stress in their life. So what are we talking about when we talk about stress? Simply put, stress is going to be a reaction to any sort of change that requires a person to modify the way they do things, to adjust to the way that they're living their life, to figure out what's working, what's not working. Stress can come as a result of things in the environment, so things that are outside of us, or things that are internal, whether it is physiological changes, things that you feel within your body, illnesses or disease symptoms, or sometimes even from the way that we think. And what we do know, and I think this is something that everyone here can attest to, is when you have stress in your life, when you're experiencing a change in levels of stress, it can have an impact on you physically, mentally, and emotionally. So when we think about that a little bit more specifically about people who are living with Parkinson's disease, I'm not going to get too deep into this because I think this is something that everyone is familiar with. When you are under stress, it tends to make Parkinson's disease symptoms worse. And this is something that people report across the board. And it's not just the motor symptoms, but it can also be the non-motor symptoms, mood symptoms specifically, but also things like sleep and digestion and things like that are going to be affected by increased or additional stress on the system. We do know that with increased stress, a lot of times we see more physical symptoms. Tremor in particular is really responsive to increased stress levels. We'll see people's tremor get worse, but that's true for stiffness, slowness, balance issues, et cetera. Those can all become worse. We also know that with the mood symptoms, anxiety can be a very common feature in Parkinson's disease itself, and not necessarily just related to stress that a person is experiencing. But because anxiety being a little bit different than stress, right? I think a lot of times we'll hear the two terms used interchangeably, but just remember, stress is something that is an external source. Anxiety is an internal source. Anxiety can be something that is happening because of the way that we think about things or perceive things. It can also be because of a neurochemical change in the brain, which when we're talking about Parkinson's disease, we do know that anxiety can be very common in people who have PD. And in fact, people can say that it fluctuates throughout the day, right? As levels of dopamine changes, you know, when you take your meds, when you're on, people tend to do a little bit better. When your meds are wearing off, when you're in an off period, that's when people tend to be most anxious. I think it's important to point that out, and something that I try to tell people all the time with changing mood symptoms, especially if you've had a bad week and you're like, oh my God, my anxiety's been all over the place for this past week. Don't necessarily try to change your medications right away. Talk to your doctor, because a lot of times it's about dealing with stress differently that it can have an impact on the way that you're experiencing that. I also think it's important, especially for a group like this and what PCLA does and who you all serve and represent, we need to look at the fact that we are also talking about the people who are living with someone who has Parkinson's disease. If you are a care partner or a spouse or a family member or a friend of someone with Parkinson's disease, unfortunately, you're not immune to stress. So there are things that the person who is the person with PD is going to experience as well. So I'm hoping that this talk today is going to address both of the groups, the people with PD and the people with someone with PD. So let's talk about why we're having this conversation today under the context of stress during the time of COVID-19. Like I said before, COVID-19 is something that none of us have had really prepared for, and nobody really had a lot of experience in dealing with. This is a worldwide event. It has affected everyone across the globe. It came on and disrupted things suddenly and quickly, and this changed the way that people were living. Things that we are now probably very familiar with, this idea of, you know, staying physically distant from people when you're out and about. It has an impact on the way you work or go to school or your social life. I mean, it affects all aspects of the way that a person lives. We do know one of the hard things with the COVID-19 phenomena too is we see differences the way countries, states, counties, cities are handling it, right? There's different approaches and there's different waves. And, you know, this is something I've been talking to folks a little bit about who have family overseas who are like, well, you know, my family in London, they're out and going and doing these things, but we're here in LA and we're still not able to do it. And there's a lot of different levels and different ways that this is impacting people. So I just want to be clear that this is something that has affected the world, has affected us all very quickly, and maybe now been lasting a little bit longer than any of us might have expected when this first started back in March. I'm sorry if you guys are hearing that beeping thing. I'm trying to adjust my screen and I guess I'm doing it the wrong way. So I'll try to stay on top of that. Some of the things that can be impacted when we are under stress, and particularly under stress due to the COVID phenomena. Mood changes. These are things that we see a lot of, and primarily the problematic mood symptoms that people are reporting due to this new change in stress are things like anxiety and depression. Helplessness is another big one. People just feel like there's nothing they can do about this, and that leaves a person feeling helpless. I did not put this on here, and I'm now realizing I should have. Boredom is something that we're talking more and more about now too. There was an interesting article in the New York Times a couple days ago that was saying, you know, is it that we're depressed, or are we just bored? It's hard to say. We can tell, right? There's diagnostic criteria that can say it, but when you're the person who's experiencing it, it's hard to say, look, am I just bored and just don't want to do anything? Or am I depressed and having a harder time doing the things I want to do? It's not always clear. I put loss up here too. Loss is a big thing. Loss of things like milestones, right? If you were someone who was going to celebrate a big birthday, or you know, your kid or your grandkid was graduating from high school or college, we've not been able to do those things like we used to. Planned things like, whoa, our big family trip that we were going to go back east over the summer, we might not have been able to do something like that. And even our day-to-day activities. I think we're seeing this differently now than we did several months ago, but people are still in varying degrees thinking about, how do I even go to the grocery store? How do I deal with this? What do I do if I need to go get my meds? Do I want to go to CVS right now? Does that seem like a good idea? These are all things that we're dealing with differently, and that does have an impact. It's that loss of spontaneity. It's the loss of connectivity. It's loss of your usual relations with family and friends. These all are adding up. Another big one that we experience, specifically with the COVID phenomena, is an increased reporting of fear, an increased experience of fear. COVID-19 is life-threatening. I mean, that's the simplest way to put it. It is something that can realistically threaten someone's life. We do know that the severity of the disease does tend to affect older people more, people of Black and Hispanic ethnicity more. This is something that can really make a person sometimes even afraid to leave their house. But it's also something that is frightening because we don't really know, we're learning more and more, but we still don't know all that much about it, right? Why does it affect someone fairly mildly, and why does it kill someone else? There's a lot of questions that we have, which just does lead to increased worry or anxiety. It's things that we are concerned about, like going out. Are the other people around me healthy? Is the person who's coming to my house, say you've got in-home physical therapy, is my therapist healthy? Are they practicing, best practices when they're home? These are things we don't always know. And that can lead to us feeling more concerned. There's also the concerns about self. I'll talk about this a little bit more in the slides ahead, but I don't know about you guys, but even as I'm talking right now, my throat's starting to get a little scratchy. There's that part of your brain that's going, I wonder, these are very normal things. And it sometimes is something you can brush off. Other times it can really lead you to feel more stressed or worried. Loneliness is another significant factor that we've seen with people who are living during this time of COVID-19, and for people who are living with Parkinson's. I'm going to add something that I didn't say before too. I know from my work and talking to people, there was a large group of people who said, you know what, this isn't all that different from how I was living before. My mother-in-law has Parkinson's disease, and she's like, look, I never left the house that much anyways, right? She's like, I would go out once a week for my groceries. This isn't that big a change. So some people have actually said it's not that different. And I just want to put that out there too, to normalize that some people don't feel these things that we're talking about right now. Back to task. Loneliness is something that people are reporting more of. And this is understandable. We don't have the same outlets that we used to. If you take part in a support group, you might not be going to the physical meeting space anymore. And while it's great that we're able to do these things via Zoom, it's really different, you know, seeing people that you know or meeting new folks over your computer screen than it is in person when you could shake someone's hand or give someone a hug. So we've had people saying these things are noticeable and different. And for people that are feeling lonely, we do know that ongoing states of loneliness, people who are feeling disconnected and who may experience other negative emotional responses due to it, can actually begin to have an impact on their health because of those things. We do see that people who are isolated and lonely and feeling negatively about it tend to have a weakened immune system, which makes them more susceptible to other things too. Another impact of stress on people who are dealing with these changes due to COVID-19. And this might not sound all that different to people who are living with Parkinson's disease. It can have an impact on the way that we think. It makes it harder for people to focus or pay attention to things. It can make it harder to organize the way that you organize your thoughts, put them together in such a way that it's going to be a logical progression in an activity, making it harder to get things done, making it harder to get things done on time. It can lead people to feeling overwhelmed, exhausted. I can't think of an alternative for preoccupied, but it's a great word, right? You have something else on your mind, which makes it harder to pay attention to something else. And concentration is also impacted by the fact that your usual routine may have been thrown up in the air. Oops. Another impact of stress during this time of COVID-19 is the impact on sleep. Again, this is something that is not new to people who are living with Parkinson's disease. And I think that's why it's important to point out, you can have an impact on things from the disease you're living with, whether you have it yourself or the person that you love has it. And you could be experiencing it due to what's going on in the world right now. So we see people having difficulties with sleep, and that can be either you can't fall asleep or you fall asleep too easy. You sleep way more than you used to, or you're sleeping way less than you used to. A lot of people who had regular routines outside of the house are now reporting that their sleep schedules are off, right? You might stay up later watching TV and therefore you sleep in a little bit later in the day, where in the past you used to get up and go for a walk or go to your exercise class first thing in the morning. So we see people getting these shifts in their sleep schedules. And lastly, there's an issue with daytime fatigue. If you're staying up later, sometimes you're sleepier during the day. If you are not doing the usual activities that you used to, that can lead you to have less energy. All of these, if you're bored, you sometimes feel sleepy. There's also some physiological changes that are related to living with stress. And again, some of these might seem kind of, might sound kind of similar to things that you might experience just living with Parkinson's disease too, right? Things like low energy or tightness, muscle pain, GI issues. Other things that we know people can experience due to stress are things like shortness of breath, chest pain or tightness, which again, during the time of COVID-19, if you're feeling short of breath or you feel like you've got your chest is tight or you got some chest pain, that can make you think about COVID itself. So these things all relate and they all kind of feed each other, if you will. Another thing that we don't talk about a whole lot, but I think is an important thing to pay attention to is sometimes because of the changes in the world and what we're doing to try to cope with COVID-19, sometimes we're home together too much. You don't necessarily get a break from the person that you're living with in a way that you used to. You might be dealing with things that are safety concerns, right? If you pay attention to the news, you might see things about concerns about drug and alcohol use or physical abuse, relational abuse. These are things that we are noting an increase of due to the fact that people are stuck at home together and not necessarily with the ability to get out. When we think about that with Parkinson's disease, it's not always necessarily a product of someone living with Parkinson's. A lot of times we have to say, hey, were these things that were concerns pre-diagnosis? Were these things that, did a person have personality issues or certain behaviors that were worrisome before? Some people might exhibit those changes due to disease, and that might have been something you were working with your care team with pre-COVID. It's something to really pay attention to and talk to your team about during this time as well. Safety concerns, not just for the other in the relationship, but also for the person who is the focus of this conversation, whether it's the person with Parkinson's disease or if the care partner is someone with behavioral concerns that we need to be aware of. Bottom line is safety is always something that we want to try to emphasize. If you ever have questions or concerns about it, please do talk to your care team about that. So what I really wanted to spend time on today, and hopefully I didn't waste too much of the time getting into it. What can we do to manage stress during this time? How can we act? What things can we do that are gonna hopefully benefit us while we are dealing with this increase in stress due to the changes in the world due to COVID-19? Kind of on a simple level, I like to tell people, it's important to think about putting the energy that we have into areas of our lives where we do have control more than areas you don't have control. For example, if I'm feeling totally stressed out and I'm starting to go a little stir crazy at home, I can do something more about that than I can do about, what the color of the sky is or how many cases of COVID-19 there are in the city of Los Angeles. You want to try to focus your energy on what are the things that I actually have some direct control over, because I can do something about that. And that will actually in turn make me feel a little bit better. So keep that in mind as I talk about the next few things that I encourage people to focus on to help deal with their stress right now. First and foremost, use your best practices to stay healthy. Make sure you are working on your general health right now. Do everything you can to stay as healthy as possible. I apologize for the cheeky nature of that graphic, but man, it makes me laugh every time I see it. And if you read behind the red splotch and you are offended by that, I apologize, but that's why I wiped it out. Do everything you can to take as good of care as yourself in the context of COVID-19. Practice physical distancing. That's 6 feet apart, being aware of where you're at in space and around others. Washing your hands regularly and well, not just the run them under water, but use the soap, sing the songs, count to 20, do what you will, but wash your hands thoroughly. Wear a mask. I was just at my own physical therapy appointment this morning and talking to someone there about realistically, it's not that hard to wear a mask and do the things that we do. It is a significant barrier to both spreading and contracting the virus that can lead to COVID-19. So the symptoms of COVID-19, excuse me. So please wear a mask. Be aware of what's going on in your community. What are the rules? What are the regulations? And do your best to stick by those. Another big thing to help manage the stress that people are experiencing during this time. I'll talk to folks about this a lot. And I'll say this without being overtly partisan. Politics, and especially the fact that we're in convention season, this is going to apply to this too. Try to manage the information that you are taking in. Be aware of how much information you are consuming and when you're doing it and how you're doing it. We want to be informed. We want to know what's going on, but we also are very aware that sometimes too much information can really stress a person out. So I encourage people to do a couple of simple things. First, pick one or two sources that you trust and stick with those. Anyone I talk to, you know, when we're talking about stress and we're talking about information overload, if there's someone who's on Twitter, we have to have a very tough conversation about how much of an overwhelming onslaught of information Twitter can be, because you might be following 500, 1,000 different sources and you just get bombarded with information. I encourage people to try to find a few sources that you know, that you trust, that you value, and stick with those. Try to minimize the number of times that you check your information. Once or twice a day is really probably the best thing that we can recommend. If you are someone that is checking your phone every time you lift it up, you are inundating yourself with information. This is going to inherently increase levels of stress. So try to minimize that. Know when to say when. Know when to say when for yourself. If you're able to say, hey, look, I've been on my phone for 30 minutes, I need to put it down. Or know when to say when you're talking to your best friend and they're getting deep into conspiracy theories and it's starting to make your skin crawl a little bit. Know when to say when. You know what? I appreciate your willingness to talk to me about these kinds of things, but right now, I'm not comfortable with this much information and I need to take a little break from it. Can we change the topic? Know when to say when and know how to set limits on those things. Another thing that we have direct control over, and this is not new to any of you who's ever seen a movement disorder specialist or probably even a general neurologist or even your primary care doctor, take care of yourself, exercise, stay active. These things are so key in dealing with stress. And these are things that are even more so important now that we're living during this time of COVID-19, where you might not have the same outlets that you used to. I know things are opening up. I know physical therapy offices are seeing some people in person if people are open to it, but they're doing it in different ways. You might not be going to a group exercise class like you used to. You might be doing only one-on-one work. What we want people to do are maintain healthy habits within the context of staying as healthy and safe as possible. Home-based exercises, things like Peloton or the Nike home training app, these things are booming right now because gyms aren't open. People are finding ways that they can stay relatively active from the comfort of their own home. Now, if you're someone who's living with Parkinson's disease, you also need to be aware of what your own level of function is and what you're comfortable with and what you have the resources for or access to. But there's plenty of things out there. Rocksteady Boxing offers video classes, so you can do those exercises from home. I know Patrick's got a bunch of free exercise classes. You can find yoga classes online or on YouTube. There are so many things that are available. So finding exercises that are simple, that are things you know you can do, maybe gently pushing your limits if you're trying to increase or improve something, but doing it smartly. We don't want anyone doing something that is dangerous, like, you know, I'm not even going to suggest anything that I can think of as dangerous because I don't want anyone to do anything dangerous. So never mind where I was going with that. But just do things that are realistic and safe and things that will allow you to stay active. You can approximate pretty much everything that you might have done outside of the house. You might not have the heavy bag that you did when you would go to the boxing class, but you can shadow box, you can do footwork, you can do aerobic stuff. Try to eat well. I say healthy, well-balanced meals, and that is such a generic thing because it means very different things to everybody. And it's important to be aware of what your resources are, right? You know, if someone comes out and says, oh, you have to eat, you know, this small farm raised hyper organic stuff and, it's $20 for a bunch of lettuce. And you might say, that's absurd. I'm living on a fixed income. You got to be aware of what's realistic for you and do that, but try to eat healthy and well-balanced meals. This is also important for people who are living with Parkinson's, to pay attention to how you eat in the relationship to how it affects medications and things like that. So just take that for what you will. But then also, I always like to add this too. Healthy doesn't mean skipping dessert. Sometimes it's important to allow yourself that thing that you really like. If you like ice cream, have some ice cream after dinner. Don't necessarily eat a gallon of ice cream. That's not good. But if you have a bowl of it, and then you're doing these exercise routines at home, balance is key. Try to avoid drugs, alcohol, tobacco. I mean, that's healthcare 101. You're not gonna talk to a doctor who's gonna tell you, yeah, go buy a pack of cigarettes. It's a good idea. No one's going to say that. If you do smoke, you're aware of that. I hope you are talking to your care team about that. But we try to encourage people not to engage in excessive use during this time. It is easy for a person who may have been a 1 or 2 glass of wine a night person to suddenly find themselves drinking 3 or 4 glasses of wine. If you're noticing those kinds of changes, talk to your team about it, talk to yourself about it, and make changes as necessary. And lastly, do what you can to get good quality sleep. Sleep is not something that is immediate. Sleep is not something you can say, okay, I'm going to lay my head down and then I'm going to wake up 8 hours from now. It doesn't work like that. But do things that you can to maximize the quality of sleep that you are getting. Try not to sleep with the TV on or your phone on or the lights on. Do things to minimize the impact on sleep. If you wake up because you have to go to the bathroom in the middle of the night, that's normal. If you go back to bed and you can't fall asleep within 20 minutes, there's techniques that we can talk about, things like sleep hygiene rules that you can Google that will tell you, if you lay down and you can't fall asleep again in 30 minutes, get out of bed. If you're just laying there tossing and turning, that's not helping you. Go sit in a chair somewhere and read something or do something like that. We could have a whole other conversation about sleep. What I'm going to leave this with is do what you can to try to improve the quality of your sleep as best you can. Relaxation training. If you have not heard about this or tried this, I can't emphasize this enough. And I'm going to go on record and say, if we were having this conversation a year ago, I would have probably rolled my eyes and said, I am not good at meditation. I cannot sit still long enough to be mindful. Relaxation training, who's got time for it? That would have been me. During the time of COVID-19, I will honestly tell you that I practice meditation like I think it's going out of style. It's something that is an interesting and useful technique that can have a significant impact on stress. What I've put here is just a simple outline of a relaxation training exercise that is called diaphragmatic breathing. Really, truly, it's just focusing on your breath. You were going to be breathing anyways, so if you can turn your breath into an exercise that can ultimately have an impact on the kind of stress that you're experiencing, I say go for it. I'm going to talk you through this one real quick. It's super, super simple. It's a task that we encourage people to do while seated, because if you're laying down and you do it, it's really easy to fall asleep. So you can also practice it at night when you're trying to improve the quality of your sleep or you're trying to go back to sleep after you went to the bathroom. But I encourage you to practice it during the day when you're less likely to sleep. Sit in a chair, sit with your feet flat on the floor and your hands either on your lap or on the arms of the chair. What you do not want to do is be crossing your body or closing yourself out. Once you get that gentle position or that kind of open position, just inhale through your nose and feel what it feels like as the breath is going in. You're not doing anything special. You are breathing in. Just pay attention to what it feels like. Once you take your breath, exhale. Exhale through your mouth. Feel what it feels like as your body kind of sinks into the chair, as your belly deflates a little bit. You might feel like your body gets heavier as you exhale. Paying attention to these sensations, both of inhaling and exhaling, is going to change what you experience while you breathe. I encourage people to do this 10 to 20 times. This will maybe when you first start take you a couple of minutes, but then you'll find that as you practice it more and more, you can start building it up. You might find that you take 20 breaths over the course of 3 minutes. You might say, you know what, I'm going to do this exercise for 5 minutes. There's a lot of different ways to do it, but the simple focus on breath, sitting comfortably, inhaling through your nose and paying attention to the sensations, and then exhaling and paying attention to the sensations, is one of the easiest exercises you can do. If you are interested in progressing a little bit further, I put up this picture and the website for headspace.com. It is a fantastic guided meditation app that you can find. If you are a smartphone user, or if you are comfortable on the computer, which I'm hoping everyone who's on this Zoom call is, it's a great resource. They offer some free levels. They also have subscription levels. So it's something to look into if it fits your idea of a useful tool and you can justify it. There are also plenty of free resources out there too. Again, so many things on YouTube. If you just Google breathing relaxation exercises, you can find this kind of stuff. It can be super helpful to have something coaching you through it, so you're just not doing it yourself too. Another great tip for managing stress is structure it. Make yourself a schedule. Before COVID, you might have had more of a schedule. I go to boxing Tuesday, Thursday, and Friday. I have physical therapy on Monday and Wednesday. I go to support group Monday afternoon. I have lunch with friends on Thursday. Your calendar might have been a little bit more packed. Today, you might be going, I don't got anything on the calendar. I don't know what's going on. Make a schedule. Even if you are just scheduling what you're doing at home, if you've got a to-do list, if you've got a calendar that says lunch is at 12, pills are at 1, I guess pills would be closer to 1:30, watching this particular show at 3 o'clock to 3:30, calling my friend at 4 p.m. Put these things on your calendar. Put these things on a to-do list. Make it an operationalized, scheduled routine. What time am I getting up every morning? Set your alarm for the same time every day, even if it's on the weekends. Don't just say, I'll wake up when I wake up. All of these things help provide a structure and our brain responds to it. Putting a dedicated time to exercise, we were talking about that before. Put it on your calendar. Even if you're just doing some stretching at home. Yeah, I'm stretching from 10 to 10:15. Put it on the calendar. Make appointments to connect with friends and family. If you're at home, make time to talk to your husband or wife. Hey, let's put it on the calendar that we sit down and talk for 15 minutes this afternoon. How does 3 o'clock work for you? That's not good for me because I've got my online class at that time. Great, let's do 4. Putting things on the calendar makes it more official and our brains respond to it in a different way. In line with that, make time to be alone too, right? That we're home together too much. From 4 to 4:15, I'm going to go sit in the bedroom by myself. Please do not knock on the door. Please do not open it. That is my time. And then use tools to do it. I've been saying put it on the calendar. There's a lot of different things that we can use. I'm a big fan of these big old calendars. I'm a big fan of to-do lists. I'm a big fan of timers, that old school kitchen timer that you got. Hey, my alone time, I need 15 minutes. Look, I'm setting the timer right now. These things are great tools and boundary setters and structural reminders. If you are a fan of technology, if you've ever talked to me before, I'm telling you all the time how I program everything into my phone calendar. It sends you alarms, you can send alerts, anything like that. There's lots of different apps for med management, all kinds of things. If you are tech savvy, use it. I put family meetings up here. If you are living with other people and you are dealing with all these kinds of things, it doesn't hurt to sit down regularly and talk about what's going on, what's working, what's not. It gives you an opportunity to brainstorm together and make changes if need be. Lastly, I put rewards. I don't know about you guys, but I am more motivated if I know that there's going to be a prize for me at the end of something. And I put McDonald's French fries up there because I think I'm always thinking about McDonald's French fries. But man, if I want to make sure I get the housework done, I can guarantee I'm going to finish my chores if I know that I get to go to McDonald's at 12 o'clock. So sometimes programming reward helps motivate behaviors and increases the likelihood of us succeeding in what it was we wanted to do. We talked about loneliness before. Stay connected during this time. The fact that you're all on this Zoom meeting right now, I'm hoping people have participated in online support groups or virtual visits with their doctors. There are ways for us to stay in touch. Set up family dinners. I talked to someone who did a virtual Seder and talked to, people who are like, yeah, I go on coffee dates with my friend every week at this time. And, we both sit in our backyards and we talk over FaceTime at that given time. These kinds of things can be really good at helping us stay connected. It might not be the same as seeing someone in person, but it sure approximates that. If you have the access to these video platforms, like all of you here who are doing the Zoom meeting, it can be really helpful when you are making eye contact with someone, even when it's across the screen. But if you don't have the tech available, if you have friends or family that don't have it, give them a call, because hearing someone's voice is better than not hearing it at all. And lastly, if you don't think you're dealing with stress well, if you feel like it's getting the best of you, reach out. Talk to your care team. Call your doctor, your primary care, your neurologist, your movement disorder specialist. Hey, I'm having a hard time. They will realistically help connect you to resources. To everyone here, consider counseling. And I'm going to throw this at you right from the get-go. Counseling doesn't necessarily have to be with someone who's a Parkinson's disease specialist, because quite frankly, there's not a whole lot of Parkinson's disease specialist counselors out there. But if you can find a counselor who's good at helping someone deal with stress, they can learn about Parkinson's disease and the specifics that come from living with it, some of the things that are associated with the disease itself. A good therapist, a good counselor is going to know how to help someone who's dealing with blank. And whatever blank is, they're going to be able to learn about it. It's about finding convenience, someone who's got who accepts your insurance, or who is open to new patients and doing video or phone sessions. That's most important. Check out the resources that are available on sites like the PCLA website. It's a great place to find support resources, groups, things like that. There's other orgs out there too, but talking to your care team, going to the places where you know that are vetted resources. And then lastly, if safety is a concern, going back to what I was saying before, if you are dealing with someone who's got significant behavioral issues, if there are abuse issues, contact help. If you feel threatened, call 911. It is simple. It is hard to do, especially if we're talking about a loved one who's dealing with behavioral changes, but safety first and foremost. I just blasted through a lot of stuff real quick, and I am going to make my presentation available via PDF so you can all have it on the website. But wanted to just give you that give you that overwhelming overview of stuff. But there's so many different things to think about, and hopefully so many different resources for you all to consider that will help deal with the types of stress that people are experiencing specific to COVID-19, but also just living with stress in general and related to living with Parkinson's disease. So thank you for that. I'm gonna drop the screen for a bit, and then I know Joe's been collecting questions, and let's hit as many of those as we all can.
Thank you very much, Dr. Johnson. I'd also like to add, from my own personal experience, something that I've found a lot of pleasure and relief from is gardening lately. It's something that most of us have access to if it's planting a potato or cutting an old vegetable scrap and putting it in a glass of water, or putting your hands in dirt. There are many benefits of seeing something you planted grow, and also the ability to share that produce with the community. So I'd like to add that to the wonderful list of assets and tools and tricks that the doctor shared with us.
That's great.
Now, as the doctor mentioned, I'd like to get to a few of the questions that we received through the chat box, and then we'll follow those up as time allows with any verbal questions for those of you who weren't able to send us your question. The first question we received is regarding, are there any issues with taking over-the-counter sleep aids for people dealing with Parkinson's, doctor?
My first response is always talk to your medical doctor about this. There are, of course, impacts from taking over-the-counter sleep aids, but they're over-the-counter for a reason. These are things that are known to be safe to the majority of the population. It wouldn't be over-the-counter if it wasn't. Things like melatonin, things like ZQL, they all have different ways of working and can have different impacts on a person's brain. So again, it's going to be specific to the individual, but definitely talk to your doctor about it. If they think there's anything that's contraindicated from you doing so, they should be able to tell you. Things like melatonin, safer, right? This is not a medication. It's actually a natural supplement that is a signal, that is a compound that signals your brain it's time to go to sleep. It's something that's used a lot in Parkinson's disease, especially people who have REM, sleep disturbance behavior issues, like the kicking and acting out of dreams. It's a very normal thing that doctors will prescribe, and that's something you can get at Ralph's. Get guidance on it. Just follow the bottle directions. Don't overdo it.
Thank you very much, Doctor. Our next question is if you could help our audience distinguish between reactions generated from stress, from isolation, and from more traditional symptoms of the progression of Parkinson's. How would we know which is which?
It's going to be hard because, as you've probably heard, Parkinson's is different for everybody, right? There's some normal common threads that carry across, right? It's why we can, give treatment guidelines and things like that. But the way people experience Parkinson's is going to be based on their disease, but also their innate coping mechanisms, how they deal with things. What I would say, kind of on a simplistic level, if there are things that you've been experiencing more in the last few months, chances are, like if they've really changed a lot in the last couple of months, probably more to do with stress from COVID-19 just because of time. Parkinson's changes over time, but Parkinson's doesn't really change overnight, right? Parkinson's is a gradual, progressive condition. So if things have happened fairly quickly, that would be a way of saying, oh, I think this might be more related to the stress of what's going on. If it's something that's been building for a while, it might be more the Parkinson's disease. Honestly, the answer is talk to your care provider about what the specific things are that you're worried about, and they should be able to suss that out. But I think on a simplistic level, if it's more of a confined acute thing, I would say chances are it's related to this. If it's something that's been building for a while, chances are it's more of a Parkinson's related thing.
In responding to a couple of the questions we received in the chat box regarding recent diagnosis of Parkinson's or concerns about over-the-counter medicines interfering with doctor-prescribed medications, please follow up with us offline and we can help deal with those on a case-by-case basis. I'd like to now open the floor to anyone who has a verbal question that they'd like the doctor to address. Feel free to unmute yourself and speak up one at a time.
Hello, can you hear me?
Yes, we can hear you.
Would you comment on mindfulness training? I started with the diaphragmatic breathing and the deep breathing and slowing it down, and I kind of transitioned into like a mindfulness and staying in this moment. Because you're right, there's too much going on. There's the election, there's COVID, there's, crisis after crisis, that I'm the type of person, I could make myself crazy. And I just made a decision one night that I'm not going to do that. I am not going to be the one to make myself crazy, about all the stuff. So mindfulness training has been immensely helpful for me.
I am so glad to hear that. I'm also so glad to hear that you made the decision not to go crazy. I think that was a good one.
Most of the time, not always.
Mindfulness, I think, is something that people sometimes get a little confused about, right? It seems like it's this thing that we don't, it's kind of untangible. But to your point, Betsy, really what it is about truly staying in the moment. Mm-hmm. Mindfulness is being aware of what you're thinking, what you're feeling, what your body's experiencing right now, not what it's going to be feeling in 10 or 20 minutes, not what is going to be happening in a year or two, not what you experienced last winter. Mindfulness is being here, grounded in the moment. Like you said, you started with the breathing exercises. Those breathing exercises are mindfulness exercises. If you're paying attention to the breath that you're inhaling right now, and then you're paying attention to it when you exhale, that's mindfulness. I think where sometimes it gets a little, where we differentiate it is you can take it to a different degree, right? And that's why I like using that Headspace app, or looking at like insightla.org, which is a free website with a lot of resources on it. You can take it to a different level. You can do mindfulness activities where you can do body scans, or you can really focus on one part of your body or one specific thought at any given time that really just helps, again, ground you in that moment. They're related. Mindfulness is something that allows you to take it to a different degree. Does that sound about fair?
Yeah.
Etsy, thank you. That was wonderful. I'd like to add that in times when I'm not in immediate danger, I find it very helpful to remove myself. If I'm having a problem in the kitchen or I'm frustrated putting something together, I'll go outside, I'll go in the bedroom, I'll attend to another low priority task and allow my brain to think about what was important and what was frustrating me, so that when I reapproach whatever that situation is, I have a little bit better of a strategy developed about how I'll get the bottle open, or what I'll open instead of that, or I'll have called someone and express my frustration, and I'll say, I just need you to listen to me for a few moments. And then I've found once I've gotten it out of my head and into the world, I'm better equipped at resolving or working through or working around. In my case, it's usually opening jars. I've found a solution that allows me to calm down a bit and reapproach this issue with a different, less frustrated situation. I'd like to thank everybody. Is there any other verbal questions that we haven't got to? Please unmute yourself, say your first name, and ask the doctor.
Hello.
Hi.
Can you hear me?
Yes.
My name is Ellie, and I live in San Diego. And I had a question here. I'm 50 years old. I just was diagnosed with Parkinson, and I have a question about medication. Can you help me, or that's a different session? I don't know.
We can absolutely help connect you with resources and provide whatever we know about meditation, to be respectful for everyone's time and the doctor's time. I think that's something that we as an organization can share the resources we've identified with you offline. And we can certainly look at adding a meditation focused panel down the road. And when the doctor makes his presentation available, he did touch on a few breathing techniques and other ways of centering yourself using some practices that he shared with us.
Okay, but no medication. We don't talk medications here.
Are you asking about medication or meditation?
No, medication, because I was just diagnosed with Parkinson's, and I have issues. The doctor is trying to adjust me with medication. Like Cinemet didn't work out, so they put me on Rytary.
Ellie, I'm going to pause you there respectfully and suggest that maybe you don't share your individual diagnosis out loud. It's something we want to be respectful of the doctor-patient relationship. And we will help you offline to the best of our ability. But some of these very personal and case-specific issues may not be relevant to the larger group. So I don't mean to say it's not important, and I don't mean to shut you down in the middle, but I would like to conclude and thank the doctor, and then you can reach us offline, and we will do our very best to support you.
One quick question, please.
Yes, say your name, please.
My name is Bruce. Could you please address the anxiety and stress and panic that occurs in off time from the last medication dose at night to the first medication dose in the morning? That's a long interval. Could you please address that just for a moment?
Absolutely. This will be our final verbal question. Doctor, please proceed.
Yeah, and to your point, Bruce, we do see that people tend to report more of those anxiety feelings, some of those panicky feelings, as their medication wears off. If a person is experiencing an extended period of that, like you said, from the last dose at night to the first dose in the morning, that is something that they should absolutely talk to their medical doctor about, because if they're experiencing a heightened state of anxiety due to the medication wearing off during that time, there's other options that could be discussed. This, and on top of the medication changes or the medication questions that you should ask your doctor, we will always say there's two ways of approaching the anxiety and panic or the increased worry and stress that a person has during those off times. And whether it is a reactionary increased anxiety, like, oh, hey, I know this is going to happen, and I know I feel really bad when I go into an off time, and that makes a person anxious, or if they're feeling anxious because of the changes of chemicals in their brain, we're going to still use the same tools to try to address it. So the medical doctor is going to talk about medications that might try to minimize the off or try to decrease the amount of time that or increase the amount of time that a person has with the medication in their system. But then we would still want a person to be able to practice some of the behavioral or the more active techniques that you can do. If you know that when your medications wear off at night and you tend to feel more anxious, practice the active coping skills at night. Right? Okay, if I know that I take my last dose at, say, 8 o'clock and that I'm going to start to feel kind of bad when I wake up to go to the bathroom at like midnight or whatever. If I wake up and go to the bathroom and I'm starting to feel a little anxious, I'm going to really make an active point to do meditation or breathing or other calming activities. To Joe's point too, it's not always those active things that you're going to do. You're not going to necessarily, break out the meditation pillow and sit down and do that. Sometimes you might just say, I need to change rooms. I need to get out of this place where I'm having this reaction and the thing that I'm responding to, the trigger of whatever it is, and go somewhere else and let myself calm down, which allows me to reapproach what I was doing. There's a lot of situational or person-specific things in this that I encourage people to talk to their own care team about. But I think on a general level, if you know that there's times that you tend to feel more anxious, engage in these kinds of practices during those times or even leading up to it, right? For people who take the Parkinson's meds, if you know that, yeah, I'm going to feel my worst between the end of my 3rd dose and the beginning of my 4th dose, that would be a good time to not schedule something super important or super difficult. That might be time to put something on your calendar like, hey, this is when I sit down and do my breathing exercise, or this is when I do some calisthenics or stretching exercises. Something that isn't going to overwhelm what is already a stressful situation. Does that make sense?
Yes, thank you.
Everybody,
thank you for that question.
Yeah, much appreciated. Thank you so much.
Dr. Johnson, thank you so much. And thank everyone for joining today's Parkinson's Community Los Angeles Let's Talk Parkinson's series. I'd like to once again thank our very important corporate sponsors, AbbVie, Abbott, Boston Scientific, Medtronic, Linda and Stuart Resnick, and US World Meds for making this series possible. Dr. Johnson, I'd like to thank you for sharing your time and presentation with us. Everybody else, keep your eyes peeled for upcoming events in your email, your inbox, our website, and on our social media pages. I hope everybody stays safe, has a great week, and finds a few minutes to relax from the pressures of the world around us. Thank you, everybody, and have a great afternoon.
Thank you all so much. Take care.
Bye-bye.